Hi, Dr. Ushma. We can't hear you.
Yeah, I'm there. I'm with patient. Just give me 5 minutes. You all want me to share video or anything? Let me know. I will do it.
Okay, so we will start at 4 only.
Yeah, we'll start at
Am I
4.
audible, Dr. Ushma?
Yes, you're audible. We'll start at 4.
Sure.
Yeah.
Didi, am I like audible better than before?
No, Mansi, for me it's the same. Your voice is breaking.
My voice is still breaking.
For me it is breaking. Can you confirm? Somebody else can confirm.
Can you confirm? Is my voice still breaking? I don't know. Can anyone please confirm, is my voice still breaking?
For me it is breaking, Mansi.
Purushottam, can you confirm? Is my voice still breaking?
Your voice is somewhat clear now, so it is better.
Okay, ठीक है. So Nidhi, I'll start with the introduction. Okay.
Anything you want, any help you require from my end, Mansi?
No. Thank you so much. So yeah.
See, I can still see it live, so just checking on that.
Dr. Ushma, maybe you can just show your video once, maybe the presentation. You can just put on the presentation, maybe the first slide.
Yes, Mansi, you're saying something?
Yeah, I was saying, and you can just show your presentation, maybe the first slide once the, and then we
I
will start.
think I already did that. I'll just show it once again. Yeah. Can you see
No,
this now?
can you put it on a full screen mode, Dr. Ushma? Yeah, this is better. Thanks. Thank you everyone for joining the session. We'll probably wait for another couple of 5-7 minutes so that we have more participation. Thank you. Thank you everyone. A very happy Women's Day, International Women's Day. So we will have the session on postural correction for women. I'm sure all of us now and then go through a lot of body aches and body pains. And, since most of us, and I think, all of females have been working from home, managing work, managing house, managing kids, it's taken a lot of toll on our physical health. And I think the posture that we sit in or the workstations that we are using at home have been one of the biggest reasons. Um, as a working woman, we normally go through the issues and we don't know really what is the answer to these body pains and body aches and who do we go to. So to kind of bust the myths, to kind of help us know the correct postures, to help us find out the correct solutions, we have with us an expert, Dr. Ushma Bhojani Patel. She's a consulting physiotherapist and a postgraduate in clinical nutrition and diabetics. She is amongst very few invasive pelvic floor rehabilitation specialists in India. She has over 12 years of experience in this industry. Her expertise are joint mobilization, spondylitis, and so forth. Dr. Ushma's World of Wellness, a state-of-the-art rehabilitation and physiotherapy center with latest technologies in field of pelvic floor, providing health and fitness in every stage of women's life. Here she is with us and she will help us find the solution to our problems. Over to you, Dr. Ushma.
Thank you, Mansi, for a lovely introduction. Hello, everyone. Good evening. I wish all of you a belated Women's Day. So, a lot of you were wondering that, what is pelvic floor rehabilitation, what is ergonomics, what is so many things that Mansi has mentioned, and how are they really going to be helpful during Women's Day session for all of you is what I'm going to hear, is what I'm here to talk to you all about. So today's session that we all are going to talk about is postural corrections for female. But a lot of time I feel that in corporates, postural correction sessions are done very, very commonly, right? Irrespective of male or female. But is there any special relevance, particularly for women, that we really need to take care of? So yes, there is, and that is the main aspect of our today's. That's the main, cherry on cake on our today's session, in which we'll be talking about pelvic floor rehabilitation as well, right? So before we go to a little more women-oriented topic, let us just go into a generalized topic before we start talking about postural correction, right? So let us talk a little bit about ergonomics. So like, what is ergonomics? So if you all ask me what is ergonomics, it's nothing but just a very fancy terminology for a very simple concept, which is how to bring about fit between you and your workstation. Now, most of the time we feel that the workstation or ergonomics implies particularly for office based work only, but it's not the truth, right? Even at night when you go home and when you sleep on your bed, that is also a place where you need to make sure that the ergonomics is good, your bed is compatible to you, your pillows are fine. You're in kitchen, you're working, you're cooking something, that time also that environment is visible for you or not. That is not being the cause of causing you any kind of pain. Or else you are in kitchen or you are in your workplace and you're lifting something heavy. The simplest methods of lifting, pushing, pulling, these all are part of your environment, or else you can even call it as a workstation. Maybe not precisely workstation because you're not working on it, but yes, there are a furniture based environment which you are interacting with, and how to create a fit between you and your environment. That science is called as ergonomics, right? So, before we understand that how to create fit and everything, I strongly believe that we need to understand our body. Once we understand our body nicely, it is very, very easy to do the corrections. The most of the time we end up failing, doing any kind of corrections. The major reason is that we don't understand the base science or method of working, right? So let us first understand our body a bit. So we all know that we all have evolved from apes to humans, right? And the time when we evolved from apes to humans, there are two aspects that changed drastically in a human, which is that their spine from being parallel to the ground, it became perpendicular to the ground. And that is the reason that we all are able to use our hands, we are able to do fine movements, we are able to do complicated tasks and activities, is because that our spine from parallel has become perpendicular, right? Then more and more we became independent, more and more fine movements were done, we further went into a modern age evolution. From erect spine, now we all are again going into an ape head or a hunched back. And then this was again a evolution which is a COVID evolution. Now, when your body moved from like this to like this, two things changed. One, obviously, your upper body whole weight went on your spine. Second is that your pelvic area also changed, right? Because it was like this, the weight bearing was all on your tummy area, and now everything is in the line of gravity. So, if you see, human body is more susceptible to pains because it is sustaining itself against gravity. So you stand, you sit, you sleep, you lift things, you push things. All of these conditions you are working against gravity. And in that time, if you are not following the normal, natural nature of your body's design, we all end up with pains. What are these pains that we commonly see? Headache, back pain, neck pain, dizziness, eye heaviness. You all will not believe that in COVID times, the amount of cases that we have seen just for headache and dizziness coming due to neck pain and coming due to workstation has been so drastically risen that it is, it's surprising. And most of the reason is that we all have started working like this because we left our workstation when we were doing our work from home, right? So yes, dizziness is also a part of poor posture related problems. Then hand weakness, leg weakness, hand and leg tingling, numbness, random hand pains, leg pains, a young female complaining about knee pain or complaining about feet pain, or you can say walking imbalance. This all are very common pains that we get to see in our day-to-day OPD. And you will not believe that 70% of the cases who walk in into our OPD bringing pain anywhere in the body, if it is not a part of a trauma or accident, the cause of it is just posture that is originating from the spine. So if you will look at your spine, you will realize that how much does that spine serves a purpose, right? So in order to know that, what I want all of you to do is I want all of you to do a small activity with me to appreciate that how a natural normal spine feels like, right? So in order to do that, what I want all of you to do is I want you to sit without any backrest. So like even I was taking a backrest and sitting, so I've removed that backrest. If you have any kind of backrest, just move your body a little forward and sit absolutely without any rest. Now in this condition, what I want, so I hope I am visible to all of you, right? In this position, what I want all of you to do is that I want all of you to slouch. So slouch as much as possible. When you slouch, what happens is your shoulders roll in and you tuck yourself in. So slouch, slouch, slouch. Then again, overcorrect, overcorrect. So overcorrecting, you have to pull your chest out and your body out and overcorrect it as much as you can. Again, slouch, slouch, slouch. Again, overcorrect, 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 and then just relax. Now, every time you slouched and you overcorrected, and then last, when you just left your body in relaxed position, the position in which your body came is the neutral of the spine, in which you can appreciate a nice curve at your neck and a nice curvature at your lower back, like you can see in this photograph. Now, this curvature is very, very important. Why so? Because your spine is not made up of one bone. It is made up of multiple bones and multiple discs. And this design makes sure that your spine is very, very flexible, right? At the same time, it also takes care of a very, very important structure in your spine, which is your spinal cord. So your spinal cord is nothing but bunch of nerves coming from your head, which runs behind your spinal cord, behind your vertebral column. So if you look at the spine, the bony structure is not your spinal cord. See, this bone and disc structure is not your spinal cord. That's your vertebral column. But your spinal cord runs from behind. And this is the time when it gives out its nerve roots on either sides of your spine. Sorry. These are the nerve roots that supplies your body strength and sensation. So if you look at your spine, this is the particular area which will end up supplying strength and sensation, which are the nerve roots. Now, depending upon which area is the spine supplying, the nerve root supplies accordingly. right? So what I want all of you to now understand is, I'll just show you all a spine model for the same. Just give me a minute. It can you help me with the pelvic floor model as well? Right. So what I want all of you to now see is, see, this is your spine, right? And if I show it a little closely, see, these are the nerve roots which are coming out from either of the sides. Now, these are the roots which works as an electric supply, So like this is the main electric board. The wires that supplies to our body is your nerve roots, and your hands and legs moving are your tube lights and fan. So if these nerves are getting irritated by your constant poor posture, we end up with pains depending where the nerve is supplying. Now, if you look at the neck, just one second. If you look at your neck, the upper three nerves supplies your head and face. When they get irritated is the time when people complain of dizziness and headache. So you'll remember I told you that dizziness and headache can also come from your posture. Very common. Same way the lower neck supplies the hands. If that nerve gets irritated, we get hand pain, weakness, tingling, numbness, making rotis, and you realize that your hand is suddenly giving you a sharp pain all around your hand or giving you headaches are very common. Same way, lower back supplies your legs all the way from buttock till your legs, right? Now, if that gets irritated, people end up with leg pains or even knee pains. So, you will find a very, very young patient coming to you and telling that, oh, I have knee pain or I have heel pain, which is not common and relevant to her age. Now, the question is that this all happens to male and females both. But if you look at the research, you will come to know that the probability of all of these problems are far, far more in females compared to males. Even if you will see the ratio of knee replacement surgeries or spine surgeries is far more in females compared to males. And one of the major reasons to it is pregnancy. So a female life undergoes a little bit more spinal instability because she has a pregnancy phase which she has to go through. And we all know that a mother, when she is pregnant, her abdominal muscle becomes loose, right? So before we talk about how the mother life gets affected, let us talk about what stabilizes the spine. As I said, that back pain, neck pain are more common in female than male. The major reason being it is this is because pregnancy. Let us first understand what are the stability structures. So, if you look at the spine, a mother's body or any human being's body has the spine which has muscle support in the front, which is the abdominal muscle. We all know, we all have seen in Hrithik Roshan six packs. Then we have lower back muscles. We all have seen it in Katrina Kaif. Then down, if you will see, there is pelvic floor muscle, which we'll be talking about right now. And up, if you will see, there is diaphragm. Diaphragm is something that separates your lungs from your abdominal area. So if you look in this picture, you will be able to appreciate it better. Diaphragm up, abdominal muscle here. Down there is a pelvic floor muscle, and behind there is a lower back muscle. All of that together make sure that the spine functions well. But when a mother undergoes pregnancy, delivery, postpartum phase, second pregnancy occasionally, all of this time, again, weight gain, weight loss, due to pregnancy, these are the times when the abdominal muscle is the one and the pelvic floor muscle is the one that suffers the most. So what happens to the abdominal muscle? So I want all of you to see this picture, okay? If you look at this six packs, this is a typical six packs we all focus into. We all go to gym saying, oh, I want flat tummy. Earlier, I had a flat tummy, but after I delivered, how much ever diet I do, my tummy does not go flat. I lose weight, but my tummy does not go flat. Because we all start working on this rectus muscle. Now, below this six packs wala rectus muscle, you can see this yellow muscle. This muscle is called as transverse abdominis. And both of this muscle have a junction in between like this, which is this white sheet. Now, this white sheet is the one that during pregnancy or at the time of labor or at the time post delivery or even at times, when you lift heavy things from the ground without bracing yourself properly or the method of lifting is poor, whenever there is increase in the intra-abdominal, pressure, or else when you are too constipated, recurrently constipated for years, applying lots and lots of pressure, this tissue in between tends to open up. Usually opening up of two fingers closes on its own. But any opening up of more than two fingers does not close on its own, leaving a mummy tummy. And that is one of the major reasons that your spine is more unstable compared to men. And that is the reason that the frequency of seeing back pain is very common in females compared to men, right? Because the instability is the one that how much ever you do correction of posture and everything, still if instability is not corrected, the back pain does not go away, right? Another major reason is the pelvic floor muscle. Okay, so I want all of you to look at this. Now, if you look at this is your pelvis. Now, where is the pelvis fit in? So, if this is the spine, just below the spine, your pelvis fits in. Okay. Now, this is the pelvis that comes around your panty area or the hip area. If you look around your behind, this is the tailbone, this is the hip bone, and this is the pubic bone. All of these bones together form a cavity which is called as pelvic cavity. It's form of bones and it is called a pelvic cavity because it takes care of pelvic organs. Now in pelvis which organs fit in? There are three organs, okay? So if you look a little closely, you can see this is the bladder, tongue-like thing that you see. Bladder is the one in which urine gets filled up. This is the uterus in which the baby is there, and then this is the intestine through which the motions come out. All of these three structures fit in into a pelvis, and that is the reason they are called as pelvic organs. All of these three organs, if you see, you remember I told you all about apes to humans. So now when we became from quadruped to biped, now all these three organs instead of like this are like this, and they are not falling down, right? There is gravity down, but still they are not falling down. They are sitting nicely in this cavity. Why? Because there is a muscle down. So can you all see this muscle, right? So this, the one in my hand is from the down, and the one you can see in the picture is from the top, if you look at the muscle. So this is the muscle which forms like a hammock or a swing on which your three organs sits. Because it's like a swing, it even it suffers weight gain, weight loss, pressure, increase in intra-abdominal activity, lot of coughing, sneezing. All of this gets affected because it is not a hard floor, it is a soft swing like structure, and that is why this muscle is called as pelvic floor muscle. Why? Because it is forming a floor for the pelvis, and that is the reason it's called as pelvic floor muscle, and it's a muscle. Now the speciality of this muscle is that it is just like your bicep, tricep and your abs. So it works as per your will. You can train it, and if you don't train it, it becomes weaker with age. Now the question is, then why do I need to train this muscle? You need to train this muscle because these three organs have their mouths opening up through this muscle. So if you see this is the urinary opening through which we pass urine. This is the vaginal opening through which we have sexual intercourse or the baby comes out. And this is the anal opening through which we pass motions. All of these three openings have functions to serve. And if you see, all of these functions are as per your will. You decide you want to go to washroom or not. You decide you want to have a sexual intercourse or not. You want to pass motions or not, right? So because it is working as per your will, the muscle function is also as per your will. And as I said, that just like your bicep tricep, if you don't train it, it starts giving you problem. One of the most common problem is, as we talked about, is spine instability will further increase. Out of four structures supporting it, two are weak. Abs are already weak. Pelvic floor is also weak. Back also eventually becomes weak. So out of four, three structures are troubled. Sorry. And if that's the case, obviously the chances of back pain are more in us compared to men. Another common problem, if you don't take care of this muscle, sorry, is urine leakage, which is called as urine incontinence. Very common in females. The earliest sign is that you start waking up at night for urine streams. Earlier, if you see, none of us used to wake up at night to go to washroom. But once you see after delivery or a little later phase, you will see that people complaining, "Yeah, once I wake up at night to go to washroom," very normal. Or twice. Some people even come to me who go to 8 to 10 times at night to washroom. So that's the earliest sign. Second sign is that you cough, sneeze, laugh, party, dance. These are the times that there is little urine leakage which you are not able to control. Sometimes there is urgency. You don't do anything, you do anything, there is leaking. You want to go to washroom, before you reach to washroom, there is leaking. This all are signs which are very commonly seen after age of 40, 45. And then it becomes like itna to hota hai. So in India, I have seen back pain, mummy tummy, and urine complaints. We all have accepted it as a part of a female life. Ki, yeah, this much to happens. But the truth is, simple exercises and you can come out all of these problems. So you do not need to be with that all the time, right? So today what I'm going to do is I'm going to teach you all simple methods with which you can come out of all of these pains, right? So we will start with the first thing that we already spoke about, which is posture correction. Now we understood that why are we suffering more? What do we need to take care of? So let us start the same way. We'll first start with spine and then we'll go to pelvic floors. When it comes to spine, we all know this is the best way to come out of pain. But the big problem with this photograph is the 10 to 20 adjustments I can't really do so much. So I pick up 2, 3 and then I think I'm sitting in a good posture, but no one really sits in a good posture. And that's the place where we all fail, right? So what do we all need to do in achieve this is I have made a 6 simple step method for all of you. We will achieve same so many adjustments with just simple 6 steps. In order to do that, I want all of you to do corrections with me. I'm not sure you all are from home or you all are working from office. Wherever you all are, you can do corrections with me right now. So I'll give you all 30 seconds to prepare for your correction. What you need to do is figure out one place where you can do corrections with me. If you are at home, pick up a chair if possible, chair and table. If that is not an option, pick up a couch. If that is also a problem, then sit on a floor or on a bed. Try to make sure that bed and your floor are your last options. They are not the really friendly option. As far as possible, stick to chair and a couch. Second thing, if you're in your office, you already have chair and table, just be there and we'll get going. Second thing, what I want all of you to do is get yourself a bed sheet. Okay, so a simple small bed sheet or a towel should do. And I want all of you to come back. So two jobs I've given you. One, to figure out where you're going to do workstation correction with me. Second is to get yourself a bed sheet for yourself. I'll be waiting 30 seconds for all of you and then we will start with the correction. I hope you all can put it into chat box that you all have come back so that I know you all have come back. We'll just wait for 30 seconds and I want quickly all of you to get going to do your workplace corrections with me. So even I'm getting my bed sheet. Are you all there? Yes, can anyone help me with a message? Right. Someone has written that face has a sensory supply. Yes, it has supply from cranial nerves and not cervical. Yes. So we are not talking really about face. We are talking more about as the cervical area and head. So that is the reason we don't have complaints of facial palsy and everything, but we have complaints of eye heaviness, periorbital heaviness, headache, cervical headaches and dizziness. So these are the common complaints which comes from the upper cervical region and not from the cranial nerves. Is it okay, Kiran? Yes. So people are back, I guess. Wonderful. Chalo. So let us get started with our workplace correction. Right. So let's start with our 6 simple steps. Now, in order to do your 6 simple steps, there is one golden rule, which is that always make sure that your body, you first do your own adjustment and then do your workplace adjustment. Most of the time we end up failing is because we do our adjustments as per the environment, right? So starting with the first 4 corrections, which are our own correction. Starting with the first step, I want all of you to sit in a method in which your buttock is jammed till the end of the backrest. So if at all you're sitting on a chair, make sure that your butt is jammed till the end of the chair. Just the way you can see in the picture, right? If you're sitting on floor or bed, again make sure that you're sitting absolutely till the end of the backrest and straight and upright. As soon as your buttock touches the backrest, you will notice that automatically the lower back arch is created, something like this over here, right? Now this is the place where I want you to get your bed sheet. So 1 second. So get your bed sheet like this, right? And I want all of you to make a roll of it like this. Now, after jamming your buttock till the end of the chair, as I said, you all will realize a lower back curvature is formed. That is the place where you place this bed sheet. As soon as you do this, you will realize whole of your posture gets corrected. So you are sitting nice upright, buttock jam, roll on your lower back and back straight. Now coming to the third correction. In the third correction, in order to sustain this, you need to make sure that your leg is resting on the floor. Very commonly for females who are less than 5.2 to 5.3, even if the chair height is really low, if you jam your butt till the end of the chair, the leg keeps on hanging. These are the only people who require any kind of footrest. Okay. Now, if you do not have footrest at home, you can use a pillow, you can use a yoga mat, anything is fine, or a small table is also fine. Just make sure it should not be very high, making you sit in a squat position. That should not be the case. So you need to make sure that your feet is resting on the floor and your knee is at a 90-degree angle, which is comfortable to sit with, right? Now, when you have achieved this, now this is one possibility when the leg is hanging. Another problem at times could be if you're working from home is that your seat height is not adjustable and your leg is, hanging. Your leg does not have space. You have to bend your leg in order to accommodate. So in such cases, if your seat height is not adjustable, you can use a pillow below the chair. Jam your butt, put the roll and make sure your leg is resting comfortably, right? For the people who are sitting on the bed and the floor, you can mix and match cross leg sitting and straight leg sitting. I usually prefer for people who are old age, who already have knee osteoarthritis, should avoid sitting cross leg and should sit with their legs straight. For people who have very bad leg, lower back pains and leg pains, they should figure out which position makes them better. In their case, mostly cross-legged is better than this one. If you have any pains, ideally my suggestion is to stick to a chair or a couch. But this is only worst come worst scenario that if nothing is possible, then this other modification that can be tried. Right? So after finishing the third adjustment of your leg adjustment, let's come to the fourth one and the most important one. Most of the time when we sit straight, we do all of that, but we fail and we go on the table or on the chair because we are not able to take care of our upper body. So people ask me, is there anything that I can use to support my neck? So neck does not really require any support, but it needs to be supported at the armrest. So what you need to do is make sure that the elbow is well supported at the armrest. If your elbow is supported, you will realize that your neck is automatically taken care of. Now, in order to get this, if you have an armrest adjustment, perfect, nothing like it. But if at all there is no armrest or no armrest adjustments, in such cases, you can use a pillow like this, right? So make sure that you place a pillow between your chest and your laptop screen and make sure that you place your elbow on it. So you create an armrest for a chair which does not have armrest. For people who are sitting on the floor or on the bed, you can use a bed sheet, make a roll of it and place it around here. So if you see in between your pillow and your chest, you can take a bed sheet or a towel and you're going to create a pseudo armrest and you're going to sit on it. Even that works pretty well. Okay. So your four adjustments are done. If armrest is not there or with there, did you get an idea about that it should be at a 90-degree angle straight. Now, once you are sitting properly, then only adjustment of your screen comes into the picture. So what you need to do is that you need to make sure that your screen is absolutely at your eye level. Now, this is a time that I normally give a simple solution to everyone is to click a picture from sideways. Okay, so when if you are sitting on your workstation, just click a picture from sideways, you'll realize your screen is at your eye level or not. So the screen height adjusting, screen height adjustments that we get from the market are the ones which are the most useless ones. Why? Because they end up tilting our wrist because this, keyboard actually goes at a tilt when you try to increase the height. And that time you will be working like this, it will end up giving you a carpal tunnel pain. So the best way to get screen height to your eye level is not to buy a adjustment tool from outside, but is to just use a separate keyboard and a mouse and place your laptop on box like this. This is the best way to get it at eye level. One reason that the tools that you buy from outside do not reach to your eye level, whatever you do, So I'm just barely 5 feet, still it doesn't reach to my eye level, okay? So there is no possibility that it's going to reach to people with good height. Secondly, the angulation is going to give you wrist pain. So better to use a separate keyboard and a mouse, right? Once you have achieved this, next thing you need to take care, the last thing, which is the font, brightness, contrast and glare. So your font should not be too big, too small. Contrast brightness less than 50%, and make sure that you do not sit at a place where there is window just behind you giving glare on the screen, adding on to your eye tension. Try if possible to have a window on the side or in front. Whenever you get chance, try to look outside the window and try to look as long as possible. Most of the time people end up having eye heaviness and pains is because they keep on looking in a short environment. And when we are constantly looking in a closed environment, the eye muscles have to accommodate for shorter vision, and they become tight and painful and tired. But whenever you look far, 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 the muscles has to relax to accommodate the vision. So that is the best way to relax your eye muscle. A lot of people end up asking me eye exercises. This is one thing that you can do anytime you want, and look as far as possible. You will see all your muscles get relaxed, reducing your eye tension, right? So with the 6 adjustments, you are all sorted. At least your spine has been taken care of, that there is no further trigger. So another big question comes is, okay, if I sit in a proper posture, is that enough? Will that be okay? Can I work for 8 hours like that constantly? So the answer is no. You can't work for 8 hours constantly like that. You need to make sure that you take breaks. So that is why we have come up with rule of 8. Now in rule of 8, what you are going to do is that I want all of you to keep an alarm in your mobile, right? Which rings every 1 hourly. Make sure that there is no food or water on your desk. So whenever your alarm rings, you perform one simple exercise. Then you go to your kitchen or you go to wherever you are in your office where the water filter is available. Go and drink 1 glass of water and come back on your desk. So that means you ended up taking 8 breaks in a day, working for 9 hours. In 8 breaks, you did 8 exercises. So you revamped your posture, worked on your muscle, and you had 8 glasses of water. So you made sure your basic hydration has been taken care of, right? So this much is absolutely necessary. One of the best postures also you can't sustain for good 45 more than 45 minutes to 1 hour, right? Then the big question comes is that okay, fine, I'll do this. Then in that case, what are the exercises that I should do? So what are we all going to do now is I'm going to teach you all simple 8 exercises that you all can perform in these breaks. At the same time, I'm going to teach you what can you do for your mummy tummy and what can you do for your pelvic floor muscles, right? So I hope all of you are ready to exercise with me. Just have a little sip of water. Make sure clear out some place for yourself. Wherever you are sitting is absolutely fine. And we are ready to exercise with each other, okay? We have Dr. Heth over here who is going to help us demonstrate exercises. So, yes, Dr. Heth is here and she will help us with the exercises. If you all have any doubts, please put it in the chat box and I'll answer it at the end of the session. Right? Fine. So now what I want all of you to do is, as I said, we'll be doing exercises. This 8 exercises will take care of your spine, tummy, as well as pelvic floor. We'll first start with spine, going from your upper body. So for upper body, most of the common problem is rounded neck and forward head. In order to correct that, there is one simple exercise, which is, I want all of you to come in a standing position. Keep both the hands behind your back. Clasp it nicely. Keep your head straight up. Roll your shoulder out. And lift your hands straight up as much as possible and maintain. Hold the position for good 20 counts. And then relax. The most common mistake that we end up making in this exercise is we further pout our head forward and we bend forward. You don't have to do this, okay? So you need to make sure that your ear is on your shoulder, the neck is absolutely straight, and both the hands are behind, and you pull it behind as much as you can. Hold it for good 20 counts and then relax. You need to do around 3 repetitions in a go, okay? Coming to the next exercise, this is for your mid back. For that, you take a chair. You can take a chair, you can do it sitting on the floor. Either of them is fine, but you need to make sure that you are doing this in a sitting position, right? So for that, what you do is you sit without backrest. You sit upright. Take both the hands over your head, neck straight, and pull up as much as possible. This is a preparatory phase where you pull up your spine, you stretch it as much as possible, elongate it nicely, hold the position for 10 counts, maintain, and then take your one hand down and with your other hand tilt to the opposite side. The reason we are doing it in this position is and not in standing because we don't want your pelvic area to stretch. We want your upper thoracic region to stretch. We are doing it from mid back. Hold it for good 20 counts. Make sure that when you count, it has to be 5, 4, 3, 2, 1 at this pace. Okay, come back, relax. Currently, because I'm teaching you all, I'm not counting 20. We'll be counting it around 10 because I'm speaking in between. So I'm not counting. But at home, when you all count, you need to count slowly 20. Right? Can we do it for other side again? Both the hands together straight up. Hold it for good 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Other side. Notice. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Come back. Currently, we are doing just 10. At home, you need to hold it for 20 counts each. You can do around 3 repetitions. Right? Now, coming to your lower back. For lower back, what you all are going to do is please stand up. Now, in this, keep both the hands behind your lower back like this. Make sure you get nice support on your lower back. Then I want you to stand sideways. Make sure distance between both the leg is buttock wide. Don't keep it very wide. Don't keep it very close. Jam together. Buttock wide leg position. Keeping the neck straight, you need to tilt your lower back behind. Make sure that when you're tilting your lower back behind, you are not pushing your pelvis forward. Okay, you're just tilting your lower back behind as much as possible. Go back, go back, go back. Another thing you need to take care of is not move your neck up and down. So make sure that your neck is not going all the way tilting up and down. So this is another mistake that we commonly end up doing, right? So this is one thing that you need to take care of and you need to make sure that you're doing it right. Okay, the most common mistake in this particular exercise when we do this is that people end up with giddiness. So please take care of your neck position. Another thing particularly with this exercise is that if it increases your lower back pain, nothing to worry. But if it increases your leg pain by any chance, please stop exercising. So any of these exercises, if it worsens your pre-existing pain, make sure you consult your doctor, consult your physiotherapist, and then continue. But a simple low back pain with help of the exercise is okay. It is anticipated. But you should not end up with any kind of leg pains, right? Particularly if you are suffering with any prior pains which have been persistent for good 2 to 3 months, constantly, particularly hand and leg with tingling and numbness, please consult your doctor first and then only indulge into exercising. Currently, temporarily, if you have on and off pain, so there are some people who do not have regular pains for 2 to 3 months, but they have pains, which comes and goes. They suffer maybe once in 10 days or 15 days or a month. So in such people, make sure that you start your exercises after 2 to 3 days, and in this 2 to 3 days, particularly with respect to your neck and your lower back, apply ice packs 2 to 3 times in a day. So ice packs will make sure that at least your pains and your muscles are relaxed. You're not into any active pain, and then you can start with your exercises, right? So ice packs for people who don't have constant pain. Anyone who has constant pain for more than 2 months, please consult, then indulge into exercises. For the ones who have no pain, but this particular exercise giving any leg pain, please don't do this one exercise. Okay. So can we just see this exercise once again? Both the hands together behind, neck straight, and make sure that dizziness should not occur. So neck is straight, right? So tilt behind as much as you can and then come back. This is one exercise in which you don't do any holds. You just go behind, come back, go behind, come back. you can do anywhere around 8 to 10 repetitions of it and 1 to 2 sets of it. Okay. Now, coming to the leg exercise. So once we have covered spine, upper, mid and lower, we'll go to the leg exercise. For leg exercise, we'll first start with this quadricep stretch. Because most of the time we are in sitting position, what we're going to stretch is the anterior thigh position. Stand straight, hold on to any of the furniture in front of you, or you can even hold on to the wall, that is also fine. And make sure that you bend your one knee, trying to touch the heel to the buttock. When you do this, you will experience that your anterior thigh is getting stretched. Now in this position, if you're getting enough stretch, nothing to worry. But if you feel it's very easy, then after touching the heel to the buttock, you make sure that you pull the knee behind the body. Pull, pull, pull and maintain. While doing this, make sure you don't tilt your body forward. So can you show once? This is the most common mistake we do. So the body remains straight, heel to buttock. If it's easy, pull the knee behind the body and maintain the position for good 20 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. We'll do it for the other side as well. Bend your heel, bend your knee, touching the heel to the buttock. Body straight. Get a good stretch. If not, then get the knee behind your body. Maintain the position for good 10 counts. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Currently, I have shown 10 counts, 1 repetition. At home, you need to do 20 counts, 3 repetition each sides. Right? Now, coming to exercises when you don't get break. So come on a chair. There are people, right? When there are instances when we are sitting on the table and we are sitting on the chair and whatever we do, how much ever the alarm rings, we cannot get up. So this is one exercise you can do sitting on your chair. On top of it, like there is someone who has asked exercise suggestion for varicose veins. So this exercise works for varicose veins as well. Is that okay, Simran? I want you to check that out, okay? So what you need to do is sit straight. Now, sitting straight with or without backrest depends on how flexible you are. If you have experience of exercising yoga, you're very flexible, then only sit without backrest. Otherwise, take a good comfortable backrest and then do this exercise. Okay? So, sit with a backrest comfortably. All you need to do is lift both the legs straight up and pull the feet towards your body and maintain it. 1, pull the feet, pull the feet. When you're in this position, you will feel the stretch in your calf and the back of the thigh. Maintain it for good 20 counts. We are going to count 10 right now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. At home, you need to hold it for 20 counts and you need to do 3 repetitions of this. A wonderful stretch for the whole of the lower limb, right? Now, after doing this, you need to do is just circulatory exercise. All of these 3 exercises are useful for varicose, okay? Coming to the next variation in the same position, both the legs straight up. You need to move your toe up and down, ankle up and down. So you're up and down. Make sure you go slow and you pull it to the full range. You need to go up and down for good 20 repetitions. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. As I said, 20 reps at home. Now again, both the legs straight up. The third variation of the same exercise you're going to do is rotation. So rotate slowly from right to left. Go all the way. 1, 2, 3, 4, 5, 6, 7, 8, reverse 8. Now go anti-clockwise. 7, 6, 5, 4, 3, 2, 1. Relax. Again, this has to be 20 counts clockwise and 20 counts anti-clockwise, right? You can slowly build up. If you find it very hard, you can start with 10 count clockwise, 10 anti-clockwise. You can even take breaks in between, but gradually make sure you are able to do it all together. A wonderful exercise, circulatory, flexibility, and for varicose veins as well. Okay, so now coming to the next exercise. With this, all of your stretching exercises are done. The next three exercises are your strengthening exercises. So we have divided into upper body, lower body, and calves. So starting with upper body, what I want all of you to do is sit upright straight without any backrest, chest out, shoulder out, both the hands outstretched, wrist 90-degree. And in this position, you need to do your rotation. So go clockwise and go anti-clockwise. Okay. In this, the key to success is to go as slow as possible. Feel your upper back, your shoulder, your mid back, and your neck all working together. You can go 8 repetitions clockwise and 8 repetitions anti-clockwise. Can we go with anti-clockwise, please? Wonderful. Currently, we will just be doing around 5 to 8 repetitions. Okay, relax. Now with this, we are done with our upper body strengthening. Now let's go for the lower body. For lower body, I want all of you to come in a standing position. Right? In this position, stand close to the wall, back touching the wall, squats. Okay, like this. Make sure the distance between the leg and the wall is good enough. So distance between both the legs should be buttock wide, and distance between leg and the wall should be as per your height. Now, how do you decide is that when you go down to squat, you need to make sure that your knee should not go beyond your ankle. If it's going beyond ankle, it means you need to increase the distance, right? And jam your hands on the wall and neck on the wall. All you need to do is slide slowly down and then push your knee and slide up. The most common mistake people end up doing in this exercise is keeping less distance, knee going beyond ankle. And another common mistake is to come up with the back instead of leg. Can you show coming up with back instead of leg once? Yes, a lot of time, yes. We leave the contact with the wall. So we move our head, we move our upper body just to drag our body up. So squats, I know most of you do, but most of the people end up doing squats wrongly. So this is one of the safest way with which you can do it rightly. You can do anywhere around 8 to 10 reps, 2 to 3 sets in a day, right? Now coming to the last exercise, which is for your calves. For your calves, what do? You stand close to the wall, keep one finger support, and all you need to do is move your heel raises. You go up and down. If you find this exercise very easy, you can go up with your heel, but when you go down, do not touch down completely. Go midway only up. You can do anywhere between 25 to 30 repetitions. This is again a wonderful exercises for people who end up getting leg swelling, who end up getting varicose veins, who have circulatory problems. This is one of the best exercises again. Okay, so with this, we are done with our 8 spinal exercises, right? Thank you, Dr. Heth. Right, now coming to the last 2 exercises, as I told you all for women's health. So the first and the most important one we're going to do today is for your abdomen. I told you for your mummy tummy, right? So for this, what we need to do is I'm going to demonstrate. Okay, so you got to cooperate a little with me because you will have to see screen adjustment thoda aage piche. Now for this, I want all of you to be in a standing position. It's easier to do it in standing compared to lying and sitting. All of the positions are fine. In standing position, use these 2 fingers and try to touch it at your groin area, so somewhere like this here. This is the place where you can feel the bony joint. Now, from this area, go little inside, 1 or 2 finger inside and 1 or 2 finger down. You will reach to the base of your abdomen, just above the pubis. Now, keep your finger here just to feel the muscle work, okay? How are you going to exercise this? Breathe in with your nose. As you blow out with your mouth, you have to tuck your tummy in. So it goes like this. and then relax. So when you're breathing in, you don't do anything, okay? You just breathe in. But as you blow out, so blowing out is with mouth, it has to be slow as if you're blowing out dust, okay? So it has to be slow. As you're blowing out, you tuck in the tummy hand in hand. So it goes like this. Okay, one of the best exercise to prepare your abs to tone up. You cannot hop in directly to planks and crunches and this and that. This all will just worsen the tummy condition and not make it any better, right? Another thing that I would want all of you to know about this exercise is when you blow out, do it like this. Don't do ha. Okay, fine. Now coming to the last exercise for the day, which is a pelvic floor exercise, which is also called as Kegel's exercise. I'm pretty sure a lot of you might have heard of Kegel's exercise. But the truth about Kegel's exercise is that out of 100%, 90% females end up doing it wrong. So the best way to learn Kegel's exercise is to go to a pelvic floor rehab specialist and ask them to check, assess, and make sure that you're doing it right. But that's a difficult task. So what I have done is I've tried to make it very simple for you, and I want all of you to try it that way. Okay. Still, if you have any problem, you can always seek out for help. But I think most of the time this method works out well. So right now I want all of you to do that exercise with me. I want you to close your eyes, relax a bit. Now I want all of you to imagine as if you are passing urine. Imagine is in red and big, bold. Imagine as if you are passing urine. Now, if you want to stop the flow of it in between, which muscle are you going to squeeze? That's your Kegel's exercise. So, whole of your this urinary area is the one that you're going to squeeze. Now, the most common mistake people end up making is when the muscle is weak, we are not able to activate. Again, we have never exercised this area, so further difficult to activate. So, when it's difficult, we end up squeezing our abdomen, buttock, and thigh. So, you need to avoid doing that. Another simple way to learn this exercise is that once or twice, now this I am sincerely saying in red and bold, please listen nicely. Only once or twice, when you are in washroom, when you pass washroom, that is the time I want you to stop the flow of urine and check that which muscle is used. Don't do this exercise while passing urine every time, or else you will end up with urine retention because your bladder will not be able to clear out urine because you're constantly holding it again and again. That might end up giving you a urinary tract infection. So please do it only once or twice while passing urine just to understand which muscle is to be used. Ideally, that exercise needs to be done 100 times a day. A little difficult task to do, right? So what I've done is to make it simple is that every time when you go to washroom, after you're finished, whatever you've been there to do, sit on the pot, do 10 repetitions and come out. We all go to washroom at least 8 to 10 times a day. It will barely take 30 seconds extra. Your exercise will be done and it tied up to an activity you will not forget. But as I said, in red and bold, don't do it while passing urine, please, okay? So with this, slowly, your abdominal area, your pelvic floor area and your spinal area, all of the muscles will start working and pumping up together, stabilizing your spine better. Following a good postural precaution will make sure that we are not putting unnecessary load on our spine leading to slip disc, causing us any kind of nerve problems. And it will make sure that over a period of time, we all are pain free and lesser probability of spine pains and leg pains in females, right? So with this, I would like to summarize my today's session and I would love to take all of your questions. Right? Can we take questions? Nancy or Nidhi?
Yeah, Dr. You can take the questions. So I request the audience to please put their questions on the chat box. Should I take other questions, Dr. Ushma, which with the
I'll take care of it. No worries. So I have already answered for varicose veins. I think one of the person had asked, can we do the exercises after 1 hour of the lunch? Yes. So any one of this exercise you can comfortably do 1 hour after the lunch. Not a problem. Okay. I've already answered for cranial cervical. There's one more question asked by Sharon. Is there any connection between grinding teeth during sleep, neck problem and pelvic floor issues? I don't really think so, Sharon. There should be any connection between all of them. grinding teeth has a lot to do with mental stress, anxiety, and it's even seen in kids also if you go to see. So I don't think they're really related to each other. Yeah, neck problem and pelvic floor issues can be related to each other because their spine is it's codependent. So if your pelvic floor is weak, your spine is also not well supported, plus a constant poor posture. Eventually, when the lower back is not stable, the neck also goes into forward bend posture. A very long relation, a very far-sighted, but yes, you get to see people with pelvic floor dysfunction coming in with the neck pain, and when we assess them thoroughly, we come to know, okay, they are related. But I don't think grinding teeth is related to either one of them. Right? Is that okay, Sharon? Um, we have Sahila Praveen saying, hi, I have an extra cervical rib at the left side. Can you please suggest some good exercises which can help me reduce the pain? I didn't have any problems earlier, but these days, this is a discomforting and causing issue. Right. So for cervical rib, now again, if so far, like I don't know what's your age, but if most of your age, if it has not caused you any problem, cervical rib most of the time does not really cause problem. Okay, so if your body is already adapted, you have crossed 25-30 years of age, that could not be the cause of problem. Yeah, in young age, maybe 15-16, cervical rib can give you pain, but 30, again, I feel it has a lot to do with posture. So Sahila, I would give you a sincere suggestion is to start with whatever postural precautions I have given you. Start with your at least ice packs and make sure that you have only neck pain or you have any kind of hand pain as well. If you have any hand pain, please make sure that you get yourself assessed, and then accordingly you decide your exercises by your physiotherapist, preferably a McKinsey therapist. But if none of them, they are just on and off with big interval pains that you experience, a good postural precaution, making sure that you apply ice packs and you do all the exercises that I have taught you today. Slowly the pain should fade off. Right? So I don't think there is any need to do any special exercise for that until and unless that we have actually ruled out that the cause of it is the extra rib. Most of the time, 80% of the time, it is just postural. It just comes into an accidental finding that yes, we have a cervical rib. Right? um, the next question is from Neha Pawar, asking which is the exercise for sciatica pain. So sciatica pain again is a leg pain that I mentioned to all of you all, right? So leg pain again coming from lower back. So the best exercise during sciatica pain first, because as I said, I've not assessed all of you. Whenever we talk about radicular pains means hand pains, leg pains, extremity pain, sciatica pain, dizziness, headache. We need to see that which movement suits and which movements worsen. As per that, we recommend specific exercise. But again, if sciatic pain is on and off, not a very regular thing, you can start with a standing, put the hands behind your back extension exercise. This exercise should give you low back pain and should not trigger your sciatic pain. If that's how it works out well, that's one of the best exercise you can put into practice, Neha. And if it gives you back pain, you can do that exercise anywhere 3 to 4 times in a day. It will make sure that your sciatic pain is completely resolved. Make sure that your sciatic pain does not worsen with poor posture. So always see to it that your postural precautions are nicely followed. Is that okay? Coming to the next question from Sri Devi. Any recommendation for spondylitis? The same recommendations. Spondylitis, slip disc, spondylosis, sciatica are all fancy terminologies for the whole spine that I explained to you all. If the disc pops out, the nerve gets irritated, the bone, there is a lot of wear and tear. All of this together are named as spondylitis, spondylosis, and radicular pains. So they are different names with minor changes, but the recommendation and exercises almost remain same, and postural precautions are absolutely same for all of them. Okay. Um, Right. The next question is from Dipti asking, can you suggest exercises for diastasis recti? Yes, so the exercise that I taught you all, breathe in with your nose, and as you blow out, that is the time you have to tuck in your tummy, is the exercise that you all can do for your diastasis recti. Right? So diastasis recti is again a scientific terminology for mummy tummy that I was talking about, right? So yes, the exercise that I taught you all is one, and second is the pelvic floor, Kegels exercise. Both of this muscle together in sync are very important to correct diastasis recti. Again, if you know that you have an abdominal separation, if it is more than 4 fingers, I would suggest to follow a proper rehab under a women's health physiotherapist. Make sure that you brace your abdomen when you do exercises. Don't do it without bracing. Otherwise, it will just further add on to your problems, right? Again, for people who have leaking, diastasis problem, abdomen hanging problem, make sure that when you do not lift any heavy weights, the more and more heavy weights you lift, the more and more this problem worsens. So first work on your abdomen and your pelvic floor rehab, and then only indulge into exercises where there is weightlifting. Okay. Um, Sahila, one more question is that is there any exercises which can help in reducing cholesterol levels? So, for cholesterol levels, any exercise that you need to do, you need to make sure you do it for good at least 30 to 45 minutes. Cholesterol reduction, there are two major aspects to it. One is nutrition, and second is exercises. Exercises should have been a combination of cardio as well as, depending on what's your age, what's your fitness, you can do a mix of yoga as well as weights. So any form of exercise that requires a consistent 30 to 45-minute exercise. It cannot be that you just did one exercise 4 times a day and it will reduce your cholesterol. That all thing does not really work. Second thing, very, very important, is to make sure that the nutritional changes are at its place, and that will take care of your cholesterol correction, right? Um, Bhargavi, next question. She's asking, please suggest exercises for controlling dizziness. Bhargavi, dizziness is one thing that we cannot suggest any exercises in this format. So what we do as a McKinsey therapist is, so there is a whole science for particularly for spine specialization, which is called McKinsey exercises or mechanical diagnosis and therapy. In this, we do a 45 minutes assessment, which is compulsory for dizziness patient. I don't give any exercise to my dizziness patients without knowing their history, because they can resolve, at the same time they can worsen just with a blink of movement. So the neck movements are the one which is causing dizziness. So as a McKinsey therapist, our job is to figure out that which are the movements which are causing the disc to pop out more, causing the nerve to irritate, giving you dizziness, and which are the movements which are reducing the tension on the nerves by creating good space in the spine and reducing the dizziness is the one we need to facilitate and promote. In order to figure out which is the movement is worsening, which is the movement which is making better, there is a huge assessment which is involved, and it needs to be done very sensitively. It can be done online, but best prefer is to do it on site with the help of a McKinsey therapist or a physiotherapist under their guidance. Dizziness, I would strongly suggest you should make sure that you don't end up with very rigorous neck and back exercises. Very commonly, I have people who come and tell me, oh, I have dizziness and I do this. We do all the stretches. Multi-directional exercises are the one that leads to persistent dizziness. So it becomes better for sometimes, maybe. Sometimes they worsen it up and you just constantly be in that loop. So dizziness is one condition you really need to work closely with your consulting physiotherapist, and as per their guidance you should do exercise. It cannot be done in this format. I'm so sorry, but I hope we can help you in some other way.
Thank you,
Right.
doctor. I guess due to time constraint, we'll be able to take only a couple of more questions. If we can read out the questions which are genuinely important, I'll just pick up one or two, and the other ones you can take it ahead.
I think I've picked up two of my favorites. Can I do that?
Yes, please, doctor. Over to
Yes,
you.
there's one that is Sharon, who has asked, can one have tight pelvic floor muscles due to constant sitting or bad posture? Tight pelvic floor muscles due to constant sitting and bad posture, that cannot be the case. There, ideally, weakness could be one of the reason. Imbalance of the posture due to pelvic floor could be a reason. Tightness of the pelvic floor muscle, the most common reason is sometimes idiopathic, where people end up with dysfunction, sexual dysfunction, where they're not able to consummate, they're not able to have intercourse, or they have difficulty passing urine, they experience urine retention. If any such complaints are there, the cause needs to be figured out in the pelvic area. It could be recurrent UTI, it could be because of any kind of dysfunctions, endometriosis, PCOD, some hormonal reasons, or it could be idiopathic, just the muscle is tight since childhood because of no rhyme or reason. Okay, so tight pelvic floor muscle doesn't cause because of constant sitting or bad posture. Bad posture because of loose pelvic floor muscle is quite possible, right? And Yeah, next question you can pick up. Yeah, one more question is, can we do exercises during pregnancy? Yes, all of these exercises you can do during pregnancy. There is no contraindication. Particularly make sure you do your pelvic floor exercise, you do your abdominal exercise. Don't miss out on that, okay? So yes, Nidhi, now you can pick up whichever questions you like. These
Can
two
you
are
help
my.
in sharing the exercises for the knee pain? Also, are these exercises, can be done in menstrual timeline? Uh, any exercises which can help us to lower down the menstrual cramps? So I'm combining three questions.
Okay, I only should have selected the question. Okay, so as we have combined three questions, they're good three questions. So let's go with each one of them. Starting first one is the knee pain. For knee pain, the anterior thigh stretch that I taught you all is beautiful exercise. And second thing is, you remember on the chair that I taught you all that if you do not get a break, which are the simple exercises that you can do sitting on the chair. So in that sitting on chair, lifting the leg straight up and holding it for 10 counts without doing foot movements is one of the best exercises you can do for your knee, right? Simple one I'm telling you, but there are a lot of things that you can do. If it's a persistent knee pain, it's better to consult, right? Second question was menstrual. Can you do it during menstruation or not? Uh, your upper body exercise, the first one, the second one, you can do during menstruation. The third one, the lower back one, keeping both the hands behind and tilting your body behind, we don't do during menstruation. Other two again, anterior thigh stretch, sitting on chair and lifting both the legs straight up, you can do during menstruation. You can do shoulder rotations also. You can do calf also. We don't do squats during menstruation. So two exercises out of eight that I taught you, we don't do, which is squats and back extension exercises. We don't do. Rest all
And
you can do
the
it.
doctor, the last exercise about the muscle holding exercises during the urination.
Pelvic floor
Yes.
exercises.
No,
Yes. So
no,
Kegels
about the
exercise.
Kegels. Yes, right.
Yeah. So Kegels exercises we don't do me during menstruation. So there is no contraindication to doing Kegels exercise. Okay. You can do Kegels during periods. You can do Kegels during pregnancy. You can do Kegels just the day before you deliver. You can do Kegels as soon as you deliver. You deliver it normally, you deliver it C-sectioning, you can do your Kegels. So there is practically no contraindication to Kegels except for people who have very tight pelvic floors. So if you come into a category where you have complaint of that you have difficulty having sex, the penetration is very painful, unable to consummate. Urine retention, you go to washroom but it takes time for the urine stream to start, in between it breaks, it's not able to hold up. Or else if you come into a complaint of that you have a lot of abdominal pain and tenderness, a lot of frequency, this all are the times when kegels are contraindicated, you cannot do. But periods per se are not a contraindication for kegels, so all normal milestones are not. But if you know that your pelvic floors are tight, or if you don't know but you fall into any of the symptoms that I mentioned before, then you are not supposed to do. Rest you can do during periods, no problem. Is that okay, Nidhi?
Ushma. Yes, this was a wonderful session, and I think a lot of people have put up questions related to their personal physical health issues. So probably people write out to us, and then maybe we can suggest your contact details, and they can reach out in case it's required. This was a very interesting and a very motivating session. We have takeaways. Thank you so much, and thank you audience for the constant engagement and being so supportive with the questions. Thank you everyone. Thank you so much, Doctor. Thank you, Nidhi.
Most welcome. Thank you everyone for being such a lovely audience. I'm so sorry I'm not able to answer so many questions, but I think we all will figure some way out. And this topic that I spoke about today is one of which is very close to my heart. So I wish that it benefits all of you in some or the other way. I wish all of you a healthy and a fit life in future. Take care. It was wonderful talking to all of you. Bye bye.